Esophageal cancer is a disease that begins in the esophagus. The esophagus is a muscular tube that food passes through from the mouth to the stomach. The flat, thin cells lining the esophagus are called squamous cells. Below the surface, cells grow and divide to make new squamous cells as old ones wear out. In a condition called gastroesophageal reflux disease or GERD, frequently there's a backflow or reflux of acid from the stomach and into the esophagus. Over time, GERD may cause the squamous cells lining in the lower esophagus to be replaced with gland cells that make mucus called goblet cells. Now, this change in the lining of the esophagus is a condition called Barrett's esophagus. One type of esophageal cancer called adenocarcinoma may occur and change the lining of Barrett's esophagus. Well, another type of esophageal cancer called squamous cell carcinoma occurs in the squamous cells in the esophagus. Like all cancers, both of these types begin when the damaged or abnormal genetic material inside the cells causes them to grow out of control. A tumor forms as the abnormal cells begin to multiply. Over time, a lump may form in the wall of the esophagus as the tumor grows. Here, no symptoms are experienced in the early stages of esophageal cancer. But later, trouble in swallowing may be experienced when the tumor becomes large enough to block parts of the esophagus. Having trouble with swallowing may cause some impairment in eating. As a result, weight loss can occur in a short period of time. Depending on the location of the growing tumor, pain may also be experienced in the chest or neck. Esophageal cancer may be treated with one of the following or a combination of them: surgery, chemotherapy, and radiation therapy. Surgery is the most common treatment for esophageal cancer, especially in the early stages when the tumor is small. If surgery is to be performed, the surgeon may remove the section of the esophagus that contains the tumor, as well as some normal tissue above and below it. The surgery may include removing parts of the stomach, the procedure called partial gastrectomy. The remaining healthy esophagus and stomach will be attached to each other, and this is called esophagogastrostomy. The surgeon may also remove nearby lymph nodes to see if cancer cells have spread to them. The doctor may recommend chemotherapy as a main treatment for more advanced tumor or to shrink the tumor before surgery. Chemotherapy uses drugs to stop cancer from spreading by either stopping or slowing down the growth of cancer cells. The doctor may also recommend radiation therapy, such as external beam radiation therapy, in addition to chemotherapy. Radiation therapy damages and kills the esophageal cancer cells.